Welcome to This Month in Type 1 Research. Please check the description for the original sources, and all content is general in nature and should not be considered medical advice.
Lots to talk about this month. Yeah, research from all over the globe.
It does feel like every week there's some new discovery.
Yeah.
But before we get too far ahead of ourselves, let's step back. I noticed a bunch of studies this month pointing to a kind of worrying trend. The number of people diagnosed with type 1 diabetes is going up.
And it's not just the overall number, right? The incidence is increasing too, like the rate of new cases. This isn't just an individual problem, it's global. It has big implications.
Right, healthcare systems, society as a whole. So this brings us to a new program in Italy.
Yeah.
They've started the first nationwide type 1 diabetes screening program. What makes this one so important?
Well, a couple things. It's a two-pronged approach. First, early identification helps prevent those really serious complications like DKA.
Which can be life-threatening.
Yeah, exactly. But the second goal is what's really interesting. They're trying to actually delay disease progression. Like, can early intervention slow down the autoimmune attack?
So it's not just about reacting to the disease after diagnosis, it's getting ahead of it.
Yeah, potentially even changing its course.
Yeah.
Big shift.
Huge. And it seems like early intervention is key to long-term outcomes, which, speaking of, that brings us to another topic that kept popping up this month: health literacy.
Right. Health literacy is so important. There was a Snoping review this month all about health literacy in people with type 1. And it's not just like a summary of other research. This one is really looking for patterns, connections to understand like how health literacy influences self-management.
So they're trying to connect the dots, see the bigger picture.
Exactly. They're looking for actionable things, insights that can lead to better patient education and support, personalized resources and tools that empower people to really manage their diabetes.
I like that, moving away from that one-size-fits-all approach.
Exactly. Everyone's journey with type 1 is unique. Education and support should reflect that.
Makes sense. Okay, shifting gears a bit. We can't ignore all the progress happening with technology, right? But a UK study this month raises an important point. Access isn't always equitable.
Right. And this one focused on kids and young people with type 1. The researchers are talking to healthcare providers, trying to understand the barriers to access. The good thing is they are also looking for solutions.
That's key. So what kind of barriers are they talking about?
Well, it's complicated. Socioeconomic status plays a role, geographic location too, even cultural attitudes and beliefs about diabetes technology.
It's a reminder that just because the technology exists doesn't mean everyone can benefit from it.
Yeah, access needs to be fair and equitable, so everyone with type 1 has the chance to, live a healthy life, a fulfilling life.
Absolutely. Okay, let's zoom in on one specific technology that's gotten a lot of attention: continuous glucose monitoring, CGM. We saw several studies this month that highlight how CGM is being used. Lots of different ways to improve management.
Yeah, from improving A1C to reducing those lows and even studying the impact of glucose levels on fetal development. CGM is a really versatile tool.
And it's not just for high-income countries either. A study from Rwanda this month looked at using CGM in resource-limited settings.
And that's so important. It shows that CGM can be accessible globally.
It's great to see research focused not just on innovation, but on access and equity.
Absolutely. Advancements in diabetes care should benefit the whole world, not just a select few.
Right. Okay. Let's move on to something we often talk about: lifestyle. Diet and exercise. There was some interesting research in that area as well.
Yeah. One that I thought was interesting was looking at the effect of very low and low carbohydrate diets on A1C in adults. What's really unique is that they're focusing on the lived experiences of those individuals, not just the numbers.
Right. So how those diets impact people's day-to-day lives.
Exactly. There was also a study investigating the long-term effects of non-pharmacological things like physical activity, and things like A1C, body comp, and even cardiovascular health.
It's easy to forget, but exercise isn't just about weight management.
It really highlights the importance of encouraging regular physical activity and limiting that sedentary time to improve overall health.
So it's about recognizing that lifestyle is a crucial part of managing type 1.
Yeah, and it's about empowering individuals to take an active role in their own well-being, which brings us to another crucial aspect: mental health.
Yeah, mental health is so important for overall well-being. And this month we saw a study exploring the link between CGM and eating styles in older adults, how technology might be impacting behavior.
That's a really fascinating area of research. It makes you wonder, could using CGM actually influence food choices or the timing of meals? affect people's relationship with food?
Yeah, good questions.
And understanding these nuances is especially important for older adults. They might have set dietary habits
Hmm.
or other age-related challenges with managing their diabetes.
Right, so the technology should be there to help them, not just with glucose control, but with their well-being overall.
Exactly. And another study this month really focuses on well-being. This one looked at the challenges faced by Jordanian adolescents trying to balance life with type 1.
I can imagine that's a particularly tough time to be dealing with a chronic illness.
It can be. And this study is a qualitative one, so they are really going deep into the experiences of these young people, understanding their challenges, emotional, social, practical challenges.
It's about living a full life,
Mm,
and that's going to look different for everyone.
absolutely. And that brings us to another study. This one looked at a mobile app to support mental health for adults in rural areas.
Oh, that's interesting. What are the benefits of an app as opposed to traditional therapy?
Well, for people in those rural areas, it can be difficult to access traditional mental health services. The app helps to kind of bridge that gap, provide support.
It's about using technology to make things more accessible, more convenient.
Exactly. And this study shows how digital health solutions can improve mental well-being for people with type 1.
Okay, before we move on from mental health, I want to go back to that CGM study, the one with older adults. It made me think about the impacts of technology, the positive and negative impacts.
That's such a good point. I mean, CGM is an amazing tool, but it's
Hmm.
important to be aware of, how it might be affecting us, how it could affect our relationship with food and eating habits.
So we need to be using technology in a way that is empowering, not overwhelming.
Yeah. It's just one piece of the puzzle, really. We need a holistic approach to care, addressing both the physical and emotional.
Okay, let's end this section on a more hopeful note. So far, we've talked about managing type 1. What about changing it, modifying it?
Well, there's some really exciting research happening in that area. This month, we're looking at a narrative review. It explores a potential paradigm shift in how we treat type 1.
This is where it gets interesting. What kind of shift are we talking about?
It focuses on advancements that could change how we think about living with type 1 in the future. It's not just managing symptoms anymore. It's actually altering the course of the disease.
So, are we talking about treatments that could stop the destruction of those insulin-producing cells or even reverse it?
That is the goal. And, we're not there yet, but the research is really promising.
It's about shifting the focus, right? From managing a chronic condition to potentially curing it.
And holding on to that hope that one day type 1 might not be a lifelong burden.
A powerful message. We'll be back in a moment to continue exploring the latest breakthroughs in type 1 research. Welcome back. Lots more to dig into. One study caught my eye. It was talking about the glycemic risk index, GRI. Have you heard of this?
Yeah, it's a pretty new way to look at glucose control. And it considers more than just your average blood sugar. It looks at the risk of highs and lows, so it gives you a much better picture than just A1C or time in range.
So it's not just about hitting the target numbers, it's understanding those ups and downs, okay?
Nice. And this study, they looked at the GRI in people with type 1 who were observing Ramadan. Fasting actually improved their GRI. Interesting, huh?
It challenges the way we think about diabetes management sometimes, doesn't it?
Yeah,
I mean, it really shows that everyone responds differently. There's no one right way.
absolutely. We need to move toward more personalized approaches, tailored to each person.
Speaking of personalized management, there's a study that looked at CGM and time and tight range, TTR. Can you explain what that is?
So it's kind of like a more refined time and range. It looks at the percentage of time your blood sugar is within a narrower range, a more optimal range.
So even within time and range, there are degrees.
Mm,
Okay. And what did the study find
mm.
about CGM and TTR?
Strong correlation between the two, suggesting both are good indicators of your overall A1C. But here's the thing. The ability to figure out TTR from time and range data was better in people with higher glucose variability.
Really? That seems counterintuitive.
I know. You'd think it would be easier to predict with more stable levels, but it really highlights how important those individual factors are, like glucose variability. It's not just about the averages, it's those individual patterns, those nuances.
And that's where CGM comes in.
Right, it gives you that detailed data. It's such a powerful tool for, personalized management.
Okay. Let's talk about older adults. They often face unique challenges, right?
Yeah.
This month, there was a study that looked at automated insulin delivery systems and eating styles in older adults. What were they looking at specifically?
Trying to understand those behavioral impacts of technology, as these systems become more common, we need to understand how they affect people's choices, food choices, meal timing, that kind of thing.
And that's especially important for older adults, I imagine.
Yeah, they might already have, those set routines and habits. They might need a little extra support to use these technologies effectively in a way that works for their lifestyle.
So the technology should be there to make things easier,
Yeah.
not more complicated.
Exactly. There was also a study this month looking at pregnant women with type 1. They used CGM to see how glucose levels were affecting fetal growth.
That's a really important area of research.
Absolutely. This study was specifically looking at early pregnancy and how glucose control then impacted fetal abdominal circumference measurements later in pregnancy.
So like long-term consequences of those early glucose levels, what did they find?
They found a pretty significant relationship. It seems those periods of high glucose, even short periods in the first trimester, could have lasting effects.
So starting strong is really important.
It highlights the need for, specialized care for pregnant women with type 1.
And it's another example of how CGM can be so helpful, giving that real-time data to make those informed decisions. Speaking of which, there was another study, I think, about automated insulin delivery during pregnancy.
Yes. Comparing these systems to, standard insulin therapy during labor and delivery and in the early postpartum period.
Are these automated systems safe for pregnant women?
Well, this was a secondary analysis of a randomized trial, so pretty good real-world insights. They found that the women using these systems during labor and delivery, they spent more time in range, and they did that without increasing the risk of lows.
That's good news.
It is. But they did need to make some adjustments postpartum because, insulin needs can change so much after delivery.
So close monitoring is still important.
Always. Technology is amazing, but it can't replace, that individual care.
Okay. Let's talk about the immune system. There was a study this month about KIR plus CD8 plus T cells. What are those?
They're immune cells, and they're thought to actually have a protective effect in type 1, like helping to prevent or slow down that attack on the pancreas.
So they're kind of like the body's defense system against the disease itself.
Exactly. And they found that people with type 1 had lower levels of these cells compared to healthy individuals.
Which makes you wonder, could we boost those cells?
That's what researchers are trying to figure out. This study also looked at the effect of lipids on these cells, fats.
So what we eat could affect them.
It's possible. It really shows how complicated this all is, Genetics, environment, the immune system, all these pieces.
Okay. We've already talked about disease-modifying therapies, but there was another study looking at a slightly different approach, a paradigm shift in how we treat type 1.
Yeah, it focuses on moving away from just managing symptoms to actually modifying the disease. Really exciting.
So stopping the destruction of those insulin-producing cells, or even reversing it.
That's the goal. It's a long way off, but the research is really promising.
It's about hope, right? Hope for a cure.
Absolutely. But while we're looking to the future, we can't forget about the present. There was another study this month. It looked at access to technology for children and young people.
That's such an important issue.
It is. This study highlighted all those barriers: cost, availability, awareness. These barriers lead to disparities in health outcomes, and that's not acceptable.
So how do we make sure every child has a chance to benefit from these technologies?
That's what researchers are working on. We need a multi-pronged approach, addressing the cost, improving accessibility, educating people.
No child should be left behind.
Right. Health equity is essential. Okay, let's talk lifestyle. One study looked at the long-term effects of things like physical activity on overall health for people with type 1.
Another reminder that it's not just about medication and technology.
Exactly. This study highlighted the importance of exercise, not just for blood sugar control, but for body comp, cardiovascular health, and, just feeling good.
So yeah, we need more tailored exercise recommendations and support for people with type 1.
Absolutely. Make it a part of your routine.
There was also a study that looked at genetics, specifically genetic variations and their relationship to kidney disease in children.
DKD is a serious complication. Early detection is so important. This study suggests that some genetic markers could predict which kids are at higher risk.
So we could personalize those screening and prevention strategies?
Exactly. Identify those kids early and protect their kidneys.
I like that. Using what we're learning about genetics to improve care. Okay. Staying on the topic of complications, there was another study about kidney health in young people.
This one looked at kidney hyperfiltration. It's an early sign of stress on the kidneys. And they found that teens who had hyperfiltration were more likely to see a decline in kidney function over time.
So it's like a warning sign.
Right. We need to be monitoring kidney function really closely in young people with type 1. This study also looked at a possible new marker. It's called the urinary mitochondrial DNA, nuclear DNA ratio.
That sounds complicated.
It basically reflects the health of the mitochondria, the powerhouses of our cells. And they found that this marker was associated with those early changes in kidney function.
So maybe another early warning sign.
Potentially. Okay, let's switch gears again. This next one is about salivary levels of inositol.
Inositol. Isn't that a sugar alcohol?
It is, and they're involved in insulin signaling and glucose metabolism. This study found that the levels of inositol in saliva were different in people with type 1.
Makes you wonder if supplementation could help.
Could be. More research is needed, for sure.
Okay, before we wrap up, let's talk about a program. It's called the SEAD program, Supporting Emerging Adults with Diabetes. What is that?
It focuses on young adults, those who are, transitioning to adult care. It's a really tough time for a lot of people, and they struggle with diabetes management, which can lead to more complications and, healthcare costs.
So this program is designed to help them through that.
Right. Give them the support and resources they need, specifically for that transition.
And what were the results?
It worked. They saw fewer hospitalizations, more people using diabetes technology, and better A1C levels.
It shows that having the right support can really make a difference.
It really does. Okay, one last study. This one looked at celiac disease autoimmunity in Nigerian children and adolescents with type 1.
Celiac and type 1.
Yeah, celiac is an autoimmune condition, affects the digestive system. And celiac and type 1 can occur together.
So they were looking at how common it is.
Exactly. And they found it was present in a good number of the kids. So it highlights the importance of screening for celiac disease.
Especially since early detection makes such a big difference.
Absolutely. And the study, it's a good reminder that we need to be thinking holistically, thinking about all the factors that influence health.
Well, that brings us to the end of this part of our deep dive. Stay tuned for the final section, where we'll wrap up our exploration of this month's research. Welcome back to the final part of our deep dive. We've covered so much already, but there's still a few more studies I want to talk about. This one, it was looking at different types of insulin and how they affect things like glucose variability and hypoglycemia. It seems like there's always a new insulin coming out.
There really is. There's a lot of research going on trying to find insulins that work more like, the body's own insulin. So this study, they compared two long-acting insulins, Glargine U300 and Degludec U100 in people with type 1. And they were using CGM data to look at time and range, glucose variability, the risk of hypos.
So really understanding the subtle differences,
Yeah.
right? How they affect people differently. What did they find? Was one better than the other?
It's tough to say. They both had their pros and cons. Degludec U100, they saw slightly lower glucose variability, less time in hypoglycemia, but both help people reach, those recommended time and range targets.
So it sounds like the best insulin is the one that works for you.
Yeah, exactly. It's about personalized care, working with your doctor to figure out what's best.
Okay. Insulin pumps, another game changer. There was a study this month about pumps with hybrid closed-loop technology. What is that exactly?
So they automatically adjust insulin delivery based on your CGM readings.
Taking some of the guesswork out.
Right. This study looked at kids and teens using these systems, and they got feedback from both the kids and their parents.
I bet those systems are a lifesaver for parents. Gives them some peace of mind. What did they find? Were people happy?
Yeah, both groups were really satisfied overall, but their reasons were different. Parents were most satisfied when they saw the numbers improve, A1C, time in range. But the kids, they were more focused on how it affected their life.
So the quality of life. Feeling less restricted by diabetes.
Exactly. It reminds us that we need to think about more than just the clinical outcomes. What does it mean for the person's life?
And it's important to remember that kids and teenagers have their own priorities.
Absolutely. They need to be a part of the decision-making process, making sure the technology is right for them.
Wow. We've covered so much in this deep dive. I feel like we've barely scratched the surface.
It's true. There's so much exciting research going on. The future of type 1 research is really bright.
It's inspiring to see, so many people working to improve the lives of people with type 1.
I agree. And I think the biggest takeaway from all this research is knowledge is power. The more you understand about type 1, the better you can manage it. Advocate for yourself.
That's a great point. Remember to check out the show notes for links to all the studies we talked about.
And research is always changing, so keep learning and stay curious.
Thanks for joining us for this deep dive into type 1 diabetes research. Remember to like and subscribe, follow the link in the channel description to buy me a coffee, and thank you